Mark Reckless.
Thank you, Madam Deputy Speaker. I had thought that GPs had it rather good after their new 2004 contract. They were able to give up out-of-hours care on rather attractive terms. They saw their pay go up, and we saw a system of cough points which rather more GPs and practices were able to get towards the maximum numbers of quite quickly on what seemed to be perhaps too much of a box-ticking exercise than had been anticipated, which saw further income as well. Nonetheless, the more I've looked at this and the more I've spoken to GPs in recent years, the more sympathetic I have become to the pressures under which they operate. There clearly has been a great increase in demand for GP services, and there is not agreement on exactly how this has been caused and the importance of various factors. But I think there are clearly several factors which have played at least a part. One of those has to be seeing our population rise perhaps by close to 4 million people in a decade. And a significant part of that is immigration. Some is also natural increase. And we're also seeing an ageing of the population within that. And clearly that is driving greater demand. I'm also concerned about the change that we saw from NHS Direct to 111. I would not pretend to be expert in this or give a definitive view, but I think there is at least some evidence to suggest that the 111 service with untrained or at least not qualified nurses taking calls has a significantly greater tendency to err on the side of sending people to their GP than the NHS Direct service that replaced it, and that has been at least a partial cause of the increase in NHS demand. I think in most circumstances, I mean, there's a great variety in how often people go to the GP. I'm not a regular attender myself, although I have 2 young children. Perhaps I lean a bit more on the side of going, or certainly taking them, than I did in the past. But I think people generally come to fairly sensible judgments as to when they need to see their GP or when it's something that they can get through without that level of intervention, perhaps dealing with it just themselves or visiting a pharmacy. And I'm not sure that it's helpful to have a 1-1 system which leans so far in favour of being on the safe side and recommending people go to their GP, because clearly the 111 operators and those running that service don't want to be blamed if someone's not sent to a GP or not for medical intervention when they need it. On the other hand, they need to understand if large numbers of people are sent to that intervention, be it the GP or otherwise, when they don't strictly need it, that will mean others don't get appointments and perhaps don't get the treatment that they need. We've also, in Medway, we've seen significant population growth. And we have particular challenges in Medway, but I'm extremely impressed with our clinical commissioning group, and in particular Dr. Peter Green and Dr. Nathan, who lead that, and I think have an extraordinary go-ahead, ambitious attitude to what they can do, both in their commissioning generally of the health service, but also now I think the very positive approach of co-commissioning of GP surgeries, where I think those GPs in the lead who know it best can bring a very good basis for making those commissioning decisions. I recognise the potential conflict of interest that GPs have commissioning GP surgeries, but actually I think it's quite a good thing if we lean more in favour of having services done in GP surgeries rather than hospitals. So actually that lean can be a positive thing, and I hope the 3 different models and working with NHS England will be a success in getting the right sort of trade-off in this area. We want in Medway to attract more GPs into the area and to retain them, and part of that is promoting Medway as a place and showing that the opportunities we have relatively good value housing for somewhere as accessible to London, and really both in our rural and our urban areas, a very good and I think improving living environment. I had the opportunity myself recently to attract quite a lot of publicity to the constituency, and in particular to Rochester, which I do hope will be to the good. What we need to do as well, though, is deal with the very large numbers of single-handed GPs we have. And some of those deliver very good care, and there are one or two I understand who, I think in a self-deprecating way, may say that there's a reason why they're single-handed when they're pressed to do things differently. And of course, single-handed GPs do have a place in our system, and many deliver very good care. I do just believe, though, that if we could persuade larger numbers of these single GP practices, or even some of the smaller ones, to work more closely together and in some numbers to amalgamate, that it must be good to be able to share those fixed costs between a greater number of GPs, and that GPs would then be doing less administration and perhaps having opportunity to see more patients, or even have sort of more time off in some cases, and that there is that opportunity to work more closely together. It's also, I think, key to show the GPs in Medway that they're doing extra and interesting things, and I'm particularly impressed about the work that's recently been done on familial hypercholesterolemia. And I'm particularly interested in this because there's been a collaboration between the Medway GPs and charity Heart UK that was co-founded by my father. And I understand there is shortly to be in the British Medical Journal a study of the success of this programme within Medway, which I think could be an example to other areas of the country. And what they've been able to do is to identify hypercholesterolemia not in the 1 in 750 people they had before, or the 1 in 500 that suggested maybe normal or expected across the country, but to go down and actually find close to 1 in 350 of people, actually identify them who suffer from that condition, and then be able to put in place the preventative measures which should be able to improve health and prevent heart attacks, as well as other negative medical developments that could otherwise take place. And I think the GPs in Medway need to be really congratulated for this groundbreaking project, which I'm very, very, very proud of. The other issue I'd just finally like to talk about our GP surgeries is the difficulties and issues of getting appointments. I recognise there's no perfect appointment system that everyone will be happy with. We have also on the Hoo Peninsula a particular challenge for that sort of rural area. There was the Elms Medical Practice based with its main centre in Hoo, but without outposts around the peninsula. And just recently talking to people in All Hallows, which is perhaps 10 miles from Strood, and Grain, which is 13 miles away, and those distances from other care and facilities. There used to be 2 GP medical practices in Grain. There is now just 1, and I understand that's open just between 9 and 11 a.m. 3 days a week. But even there's a perception from some people in the village that it may not even always be available for those hours, but I would like to speak with the Elms Medical Practice before saying anything definitive on that. Similarly, in All Hallows, speaking to people on the doorstep, many are satisfied with their GP services, but there is a perception that they're not available for as many hours during the week, and particularly one day or morning may now be for training for a particular period. And again, I will check whether that's correct. And people in those areas feel underserved. We talked about this great increase in demand for GPs, but actually I'm not sure that the supply has responded, at least in these rural areas where there clearly is a need for greater GP services. I also just raised 2 practices we have in Rochester where there have been issues with the booking system. One, people are not allowed to sort of book in advance by telephone, or find it very difficult to get through. I know a lot of other members will have serious stories. But this GP practice then allows people, if they come in person and queue up outside, they are in some ways able to sort of jump the queue perhaps of people who are telephoning in. So I've been seeing large numbers of really quite elderly, often quite ill people queuing at sort of before 7:30 in the morning in some cases to try and get an appointment, and it doesn't seem to me that can be right, and I hope we can find ways to mean that people don't have to do that. Another practice in Rochester, a lady calls up, I think on the 30th of January, to ask for an appointment, and the first that can be offered is until the 16th of March. And I just think waiting more than 6 weeks just cannot be right for a GP appointment. And I'm also told that people who book online there have the preference, whereas for this lady who doesn't have internet access, that clearly is a disadvantage. And also a telephone booking system where you have 8 options, but it's only when you get through to option 8 that you're even allowed to start making an appointment, when it's very difficult to get through. I recognise there's no perfect system, but I hope to work with these surgeries to improve their accessibility to the public, and I'd like to thank all the GPs and those who work with them in Medway for the work that they do.